All right.
Well, good morning. My name is Torrey Bates. I am the executive director at For the Kingdom. And this morning, I have the pleasure to introduce and to interview Dr. Latonya Washington, who is the president of Bluff City Medical Society, which is committed to the health and welfare of African American patients in the metro Memphis area. Dr. Washington, it's a pleasure to have you on this morning. Hopefully to dispel some myths along with get some real facts out to certainly those distressed communities in our country and certainly here in the Memphis area. How are you?
I'm good. Thank you for having me, Tori. I really think that this talk that we're having is so good because it's so important that we get out appropriate information about COVID-19 because it's affecting our community in such a drastic way. I feel like there are a lot of people who aren't really taking this disease seriously, but I know that from my work in the hospital, we're seeing the numbers continuing to go up. I know that things are reopening, but every week that I go into the hospital, I'm seeing more and more patients who are affected by COVID-19, some
Wow.
who are not as sick, and some who are very, very sick, and some who have died. And so I really wanted to be able to give this information out to anyone who will listen really about what's happening with this disease, because there's a lot of information that we know, but there's still a lot of information that we don't know. And I think the things
Hmm.
that we don't know is what's very concerning.
Yeah, it's been very concerning for us as well since really we started going out into the community on March 25th, serving lunches to different areas of our neighborhood. And it's been very alarming to see how many children and families aren't even wearing a mask, are coming outside unprotected, as if there's nothing going on at all. And so maybe this will help. Sometimes education is key, right? We sometimes if we know better, we'll do better. I guess my first question for you is one, how is this disease transmitted?
Yeah, so I think it's important to first start off and say, what is COVID-19? So COVID-19 is a coronavirus. And so we've had coronaviruses in our community in the world for several years. I mean, some coronaviruses cause
Okay.
a common cold. However, this
Okay.
coronavirus is very different than what we have seen in the past. It can cause a severe respiratory illness, and then there's still several symptoms that we are discovering. Really, I feel like on a weekly basis. And so, when the reason that it's called COVID-19 is because it was discovered in 2019 in China. And that was the first instance where the virus was discovered. And so, all that to say that this virus is really transmitted by respiratory droplets. And so, when we say respiratory droplets, that means that when we talk, when we breathe, when we sneeze, when we cough, when we sing really loudly, or anything where our mouth
Sweat,
and nose
sweat,
is
and
open. So not usually sweat because it's
okay,
respiratory droplets. So anything that's coming out of the
okay,
mouth or nose is how
okay,
this virus is transmitted. We've also seen some concerns where if we cough or sneeze, that those droplets can land on a surface, and that it can also cause infection. Say if someone comes along later on and touches that surface. That's why you've seen so much information about making sure you wipe down surfaces, washing your hands, and things like that. So that's really how the
okay,
virus is transmitted. But then we now also know that there are some instances of this being really just transmitted in the air. We saw reports from, I believe it was a Chinese paper, where they had people who were in a restaurant and one of the persons was infected, and how it really spread across that restaurant through the air conditioning system. So we also know that it's airborne too. So when we say all of those
okay,
things, then that's important, because then we can break it down and say, okay, what do we need to do to be preventing and protecting ourselves. And so when
That's
we talk about
that's all
protection,
real helpful information. Go ahead. No, go ahead, please.
when we talk about protection, the main thing that we can do is wash our hands. And then the other thing is wearing a mask. I feel like I went out to the store this morning and there were some people in masks, but still some people that didn't have masks. And so that's a concern as well.
Okay. Now we've heard from the early times with New York running out of ventilators. I guess on my end, I was kind of trying to understand how the whole ventilator was working as a cure. Does it slow down the disease? And I guess the bigger question is there a cure for COVID-19?
Yeah. So as of this point, there is no cure for the disease. And everything that we have as medical professionals is really what we call symptomatic treatment. There's no
Okay.
vaccine to prevent this. There's no medication that has been proven to cure this disease. So we do symptomatic treatment. And what that means is when you have this virus, we basically support your body, give you the things that you need, so to help you survive and hope that your body can mount an immune response to be able to fight off this infection. And so when
Okay.
you talk about the ventilators, the thing with the ventilator is that this virus does affect the respiratory tract, so the lungs and things like that. So one of the things that this virus can do is cause you to have rapid breathing. Sometimes it can cause you to have what we call hypoxia, which means that your oxygen level is not what it needs to be. And so when your oxygen level is low, what we do is we give you oxygen, whether through a nasal way or through a mask, but there are escalating ways. So once we do the nasal cannula and once we do the face mask, if your oxygen level is still low, then really the highest level of support that we can provide you from a respiratory function would be the ventilator. And in that's where the machine does the breathing for you. And it kind of gives your lungs a
Okay.
rest. That's
Okay.
worst case
Okay.
scenario. That's a last ditch effort. And really for patients who have this COVID-19, most of the time when they get to the point where they require the ventilator, then we're looking at them being on the ventilator on the order of several weeks, which
Okay.
is pretty serious.
Wow. Yeah, that sounds serious. Um, Now, have we in the Memphis area seen any of these cases in children? I've heard something about some of the new symptoms in children can be rashes on the bodies and things like that. I think for those like me who have children, I'm certainly watching every day, not out of fear, but just trying to make sure that we're on top of anything. We're not going anywhere.
Right. So, initially we thought that children were not showing any signs or symptoms of this coronavirus infection. But really, over the past couple of weeks, they have started to bring out reports of this inflammatory response that children are having. And basically, it's similar to a disease in the pediatric world that we know, and it has a name of Kawasaki syndrome. And basically, it's just like everything with the body, it becomes inflamed. So you can have a skin rash
Okay.
that can be similar to like a toxic shock type of thing. We can have the tongue will look like a strawberry. They call it a strawberry tongue. And it can also affect the heart of children. Now, to my knowledge, from what we know so far, I don't know that there are children in the Memphis metro area who've been affected by this, but there are reports of this
Hmm.
affecting other children in other parts of this country. So that's always a concern for us because there's also no way that we know who's really going to be severely affected and who's not. A lot of people who have this coronavirus infection are asymptomatic. They can still
Okay.
spread the disease. And so when we think, oh, asymptomatic infection, then that's not bad. You have the infection, you don't have any symptoms, you recover, you don't even know you had it. But the concern with that is that we can pass this infection on to other people that we're not sure if they'll be asymptomatic or not. A lot of people can become very, very sick. And so we know that patients who have immune system problems, patients who have other diseases that make them more high risk for having severe COVID-19 infection. And those are people who are obese, people who have diabetes, people who have heart disease, things like that. And honestly,
Okay.
that describes a lot of people here in the Memphis metro area, you know.
Yes, it does.
And so that's the thing that's really concerning.
Okay. So my concern, of course, being a leader in a community that has over 54.2% of the families living beyond poverty means that we have a lot of essential workers, a lot of workers in local Walmarts and Home Depots, and a lot of them working as nurses assistants and, all across fast food restaurants. I guess part of what I would like to ask is a twofold question. One, how should essential workers conduct themselves in workplaces? The reason I ask that is because, if you go to a local Home Depot, you'll see they've got all of the different plastic framed things in front of every register. But behind the register, typically their employee isn't wearing a mask, right? And so my question is, saying that one, there obviously is no cure, sounds like symptoms can be picked up, like that, right? If you're exposed to someone who has it and there's nothing beyond a plastic to keep you safe from them, how should an employee conduct themselves at work? And then getting off work, coming home, should I change my clothes outside? Should I take out all my clothes outside, go inside, shower before I interact with any family? Just kind of what kind of protocol is needed in that
Yeah.
regard?
Yeah, so that's a really great question. I think that we do certainly have a lot of people who are essential workers. And we know that a lot of people have to work to support their families. Many of us,
Absolutely.
myself included, we are not independently wealthy. We have to go to work to be able to pay our rent, buy food, take care of ourselves. So we can't expect people to stay home all the time. However, if you do have to go out to work, then there are a couple of things that you can do to help decrease your risk. I really think that everyone, if you're outside of your home, you should be wearing a mask, particularly in the
Okay.
workplace. Um, a lot of the retail stores are requiring their employees to wear masks. I have seen people not necessarily
Okay.
wear their mask in the appropriate way. Some people have on masks and I see them and they have them under their chin. Like that's not helping. It's very
Right.
important that the
Right.
mask is covering your nose and your mouth. Um,
Okay.
I get that it's uncomfortable. In medicine, for doctors who are doing surgery, we wear these masks for 8 to 10 hours, sometimes for very long surgical cases. So I know people say they feel like they're gonna die wearing the mask. You're not gonna die. Like we wear these masks for 8 hour surgical cases, and everybody is fine. So it's important to wear a mask. It's important to wash your hands. It's important also that when you are in a common area, a lot of times at work, we have like break rooms and places like that where you can go sit to eat. It's important that you keep the distance between people. The 6 feet of distance that they're requiring is very important. And then when
Okay.
you get home, I recommend decontamination. This is what I do when I get home um, from work, from the hospital. In my garage, I'm blessed to have a garage. Some people don't, but I pretty much get undressed in my garage. And as soon as I come into my house, I go straight to the shower and I take a shower, make and put on fresh clothes. I really do that every time I go out my house to go to any stores or
Okay.
anything. So I certainly recommend that for essential workers. I leave my shoes
Okay.
outside, like I leave my shoes in my garage, or if you don't have a
Mm.
garage, leave them at the door, the shoes that you're wearing outside, because
Okay.
otherwise you're tracking all of those potentials for infection into your house.
Okay. So now, seemingly in our state, there seems to just doesn't seem to be an overwhelming amount of people who have it, especially in Shelby County. It would be great to kind of talk about some of the numbers. Maybe about 1 million people live in Shelby County. How many of those people would you say, have been tested?
Yeah, so the Shelby County Health Department actually has the on the website, they update their numbers weekly. I'm gonna see if I can kind of flip over to that screen and show you this information.
Okay.
Let's see here. Um, are you able to see my screen? Okay. So here we go. So this is Shelby County. So we know there are about 1 million people in Shelby County. And of those 1 million people who live in Shelby County, we have, this is as of Friday, May 21st. So as of Friday, they've had about 59,000 people who've been tested for coronavirus infection. And of that 59,000, 4,083 were positive. So that's only about 6.9%. So then when you go over and you look at the number of cases recovered, um, it's 2,815 who have recovered. So that's about 69%. And the number of people who have died as of the 21st was 91. And then the current cases, that means people who have not recovered, who tested positive, who are still within their period of infection, was 1,177, so about 28%.
Okay. So now let's say I'm out this Memorial Day weekend and I'm out with family. How long would it take? And I went and got tested on Monday, right after being out all weekend at family functions and barbecues. How long would it take for me to show up positive?
Okay. So really let's see if I can hop back to my previous screen before we,
Okay.
okay. So really it takes probably about 2 weeks. The incubation period can be anywhere um, between 7 to 14 days. So really that means that people who are showing symptoms right now really probably became infected 1 to 2 weeks ago. So we're seeing increases in numbers now, and my suspicion is it's because the distancing became lax during the like kind of towards the Mother's Day weekend, and so that's what we're seeing um, from there. I think you're muted. Sorry.
Okay.
There we go.
Okay. All right. Thank you. I'm only asking that because I'm looking at the cases and the case count seems like there are a lot of people who are currently still sick, which just
Right.
sounds like there's a lot of overlap, right? Lots of people getting well and then new cases coming in. So just curious what the incubation looks like from that. What would be your recommendation for people who are, planning to travel this summer, those who are going to events like, Memorial Day functions or 4th of July functions or graduation parties, based on everything you hear and you've seen and experienced between you and your colleagues, how should we function in this kind of new normal?
Yeah, so that's a really great question. We can't expect people to really stay distanced forever and not
Right.
get in gatherings and enjoy. This is a time where it's very difficult to maintain the distancing. I mean, it's graduation season, we're coming up on summer, Memorial Day, all of those types of things. But I will
Hmm.
really caution people to still continue to be very careful. Number one, if you have been sick, don't go out, um, because even if you were sick a few days ago, then you still have the risk of spreading this virus to other people. Um, Number two, if you are in that high risk category, then you really should consider not participating in those types of activities.
Okay.
Like I said, it's Memorial Day weekend. I know people are going to be having barbecues and things like that. We have to think about how much interaction we have with other people. Your risk of infection is increased when you have high exposure, meaning being around a large number of people in an enclosed space and you're not practicing social distancing. So when I think about cookouts, I think about everything being like potluck style, people using the same
Right.
utensils, people grabbing food off a common tray. That is high risk for infection. Really, what they recommend
Mm.
is that um, any type of cookout, the food be packaged separately and given to a person kind of in a bag or a box. I know that's difficult. I've never been to a cookout like that. So that's why I say, we really have to be cautious. And we're recommending really that the cookouts really be restricted to the people who live in your home or live in your community. It's important that you keep track of who has been there, who's been at your home, um, who's been at your cookout, because if anybody develops symptoms, then at the health department, they will want to know who those people are so that they can do the contact tracing, meaning follow up with those people for symptoms. There was a story
Okay.
that came out earlier this week that talked about a Memphis family that had a gathering of about, I think, 9 people in their homes.
Okay.
And after that gathering, like a week after, all 9 of those people got coronavirus. And a
Wow.
lot of them got really sick. Luckily, none of them died. But, that just shows that even when you're having a small gathering with under 10 people, which is what the previous recommendations were, then you can still get infected.
You still can't be sure.
Right.
Correct. Wow. Okay. Um, so I've got 2 more questions for you. I've got a ton, but I'll keep it to 2. I know it's Sunday morning.
We can reconvene at another time and answer more
Okay.
questions,
All
because
right.
I'm okay with answering any questions. I don't think there's anything. I don't think there is a stupid question in regards to COVID-19.
Okay.
It's very important that we get as much information out there as we can.
Okay. So give me 3 then, if I can have 3 then.
Okay.
So my first one would be one, just for those conspiracy theorists who think that this whole COVID-19 was in a book or cooked up in a lab in China, or it's the powers that be, right, trying to distract us. And none of this is really real until, the powers that be make a decision on what happens next. Like, this is all some sort of hoax. Uh, from a medical perspective and what you've seen and what your colleagues have seen, what would you say to that?
Yeah, I will say that, this is certainly not a hoax. Um, at this point, we don't really know where this virus came from, but we know that it is here and it's very real. I mean, there are almost 100,000 Americans who have died from this virus. So we can't call something that has killed 100,000 people a hoax. Like, it's something that's very real. So I encourage everyone to really take it seriously. I've heard various theories
Okay.
from 5G. There's no evidence that this is linked to any 5G. Some of the areas that are most affected don't even have 5G towers. So that's pretty much
Right.
pretty much debunks that. There are a lot of people
Sure.
who are really um, very affected by this disease. The healthcare community, a lot of physicians, hospitals, we are very concerned about this, extremely
Okay.
concerned.
Okay. And then my next question will be for those who are essential summer workers, those who the bulk of their work is in the summer. All the college students that have come home excited about, connecting back with a summer camp and helping children. What would you say about any sort of gathering around summer camp and all of that? Not whether it should or shouldn't happen, right? Because that's going to be a organization decision. What would you think would be healthy protocol um, for any who are considering hosting summer camp?
Yeah, that's a really great question. I know a lot of organizations are wondering what they're going to do about summer camp. And I get it. The kids have been out of school for several months. I know that they want to be able to do some type of constructive activity. But really, I would say at this point, For groups that do choose to participate in summer camps, the CDC has produced some guidance in regards to summer activities. So I would encourage every organization to look at that. My personal views would be that for people who are attending the camp and people who are working at the camp, I think that they should be tested to ensure that whether they are positive or negative before camp starts. Of course, the people who are positive would not be able to participate in the camp because if they're positive, they have a high risk of spreading the infection. I think that um, the groups for the summer camps would need to be much smaller than usual. And the activities really should
Okay.
be focused on outdoor type of activities where they can maintain the distance, where we can ensure that there's adequate ventilation. And then all of the other things that we talked about, the hand washing, the wearing the mask, things like that are going to be very important.
Okay. Okay. That's good to know. Very, very good to know. We've had been asked that question what feels like a million times over the last month and a half. So it's just great to hear from your perspective what you think beyond obviously what we hear from afar from CDC and the
Right.
different task force. My final question for you is, how does your faith, knowing that you are a woman of faith, how does your faith play a part in handling patients and just balancing both medicine and faith? How does it go hand in hand for you, especially during a time of a crisis or pandemic like this?
Yeah, so that's a really great question. Also, I have really leaned on my faith more than I would say probably more than most, or more so in this disease. You know, as a physician, as a physician, I'm used to being able to say, okay, based on what I know with science, I can anticipate that this is what's going to happen next. And if this happens, then I can do that. COVID-19 has really said, no, you know, I talked to some of my colleagues and they call this virus the thug of all viruses because it doesn't do what it's supposed to do. It, you know, like if I think
Okay.
the next step is the patient will do this, then the patient actually does something completely different, something that I can't anticipate.
Mm,
And so I have
okay.
been very vocal about it from the beginning. I was like, only the Lord is going to see us through this COVID-19 pandemic because how else do you recover from something where there is no treatment, there is no vaccine? You know, what else do we have to lean on if it isn't faith? And so, you know, I
Mm,
believe that the Lord is a healer. And I have seen him heal several patients who do have COVID-19 and several patients who have other diseases that I didn't think would recover. And so I certainly believe in miracles. Um, I, but I also believe in science. And so for me as a healthcare professional, I really present the information um, from a scientific standpoint. I've offered to pray with my patients and with my families
mm,
and all of those things, you know, and every day when I get up out of my bed, you know, I know that the Lord works through me. And I just pray to him and say, Lord, just help me to do your work today and may your will be done. So that's really what I do daily before I go into work.
okay.
And so
Okay.
pretty much the Lord is in control of all of this. He's in control of COVID-19. We have to believe in him because he's going to save us. But you know,
Amen to
in
that.
saying all of that, then we also have to be smart and we have to follow the guidance of the scientists and the doctors. You know, I think that the Lord really put many of us here for that purpose to instruct people and to treat people. And so I really encourage you guys to really intertwine both of those things, both the science and the faith.
Mm, that's good. I certainly appreciate your time this morning. I know there's lots of things you could be doing. I appreciate you thinking enough of our community for us to be able to collaborate on putting some information out here together.
Absolutely. And so, like I said, I'm happy we can do this again. I feel like there's so
I would
much new
love to.
information coming out about this COVID-19 that it changes. So some of the things that we had a couple weeks ago, information we had a couple weeks ago, that information has changed now, or we look at it from a different viewpoint right now. So happy to come back at any time and talk about it. If you have any
Okay,
questions, just let me know.
absolutely. I sure will. I'll be looking forward to us, especially with all the talk around the surge and everything, especially
Yeah,
here in our area in the coming months. I think it would be great to get more information out here.
yeah,
Um, but have a
absolutely.
wonderful Sunday.
Thank you. And then just a final, just closing points. Make sure that you are staying safe. You know, try to avoid large gatherings. Wear facial coverings when you're out of your house. Make sure you wash your hands and make sure you keep your distancing with people. And praying that my prayer is that no one gets sick from this disease and no one dies from this disease. So, all right. Happy Sunday, Tori. Take care.
Amen to that. Happy Sunday. All right, take care. Bye bye.